When we talk about boob jobs, there are many different types of boob jobs. You can do a lift, you can do a reduction,
Correct.
you can do an augmentation, you can have a short scar, you can have a long scar. Depends how big or how small they are. You have to work with what you have. You can't have nice breasts and have a lot of lump of fat on the side. Because that lump of fat on the side, that pulls the breast to the sideways. That's why your nipples fight with each other. And
What made you want to get into plastic surgery?
in Aruba, we have so many patients that have done so many bad surgeries and no one says a thing. Breast by itself is just hanging weight. So when it's perky, when you're young, it looks nice. But when you start to develop, it starts to fall down. Yeah. Plastic surgery, actually, in its concept, is 85% reconstructive. Only 15% is aesthetic, which is your BBLs and your breasts.
Hey, yo, what's up?
Hola, ¿cómo estás?
Guys, welcome back to the ABC Island's favorite motherfucking podcast, No Filter in Paradise, a show about what, Shark?
Anything and everything.
Between what?
Two friends.
And what about these friends?
One is straight.
Who's that? This guy.
Definitely not this one, okay? I am hella gay. Y'all know that.
And obviously Shark, the gay one. Guys, welcome back to the episode. Today, it's going to be an education... English, no?
English is fine.
Perfect.
Oh, thank God.
Today
we love you, Pimento, but...
But English, like we can have more of a conversation with different people around the world. So today is gonna be an educational one, guys. We got, I think it's the first time we have a doctor on the show.
Like...
Specifically a plastic surgeon.
Okay, yeah.
Can we say that? Yeah?
For sure.
That's fine.
Yeah? All right, guys. Today we got Dr. Linde.
Linde.
On the show, guys. Welcome to the show.
Nice to have him.
No, thanks, man. Thanks. I'm happy I'm happy you're here because some people on the show call me out about my crooked nose. And today...
He's like, I saw it.
I didn't want to say anything.
He sees like, not symmetrical. We're going to have to fix that. But are you looking at my face?
He's looking.
He has a broken cartilage,
Yeah.
right there.
It's like... Anyways, Owen Wilson, all right? If you don't know who Owen Wilson is... You're too fucking young, okay? And I was like, yo, I got this plastic surgeon. I'm like, bring him because I got questions and I need to know how to make this nose. Everyone's like, oh, we tutu chiquito. I'm
Yeah, you have like a Michael Jackson nose a little bit.
What the fuck?
Like, it's cute. It's like a...
Of course it is. That's what every girl says.
Well, to be fair, in a guy, the nose is not that important as it is in
Thank you. What is important?
So
What's an important feature for a guy then?
I mean, you have to have a defined jawline.
Shit. That's why I have a beard, I guess.
A nice tushy.
Nice
Nice teeth. Yeah, a nice smile
Right
is
on
very
Teeth is always
attractive.
nice. Yeah.
Huh?
Teeth is always
Yeah, nice teeth for sure.
I got a great smile. No braces, huh?
And your shoes.
Okay, say enhance.
Like
know.
even your chin, a lot of guys have beards to hide their
Double chin.
classic chin. Yeah.
Yeah, I got a double.
Hey, there you go.
My God, fuck this guy.
Oh my God.
Guys,
I love
on
that
today's
he's just
episode-
calling out. He's like, let me just point this out.
I'm gonna sit like this all episode. Like, all right, guys. So today
He's like, while we at it,
we're
let me
hiding
just tell
my
you real quick.
insecurities. Don't give me mama. No, but you just want to see like one thing I wanted to buy one time is like these jaw something like so it helps build jawline.
Yeah, it trains your muscles that pulls your jaw, your mandible back, and it makes it look more defined.
Wait, that's a real thing?
Yeah. I saw it on.
Oh shit, I want one.
I wanted to buy so many times on Amazon, and there's like different levels, like harder, and then it just because I don't have a fucking.
Okay, I don't think I want like a.
You don't want a manly jawline.
I do. I definitely
No, you
don't want that.
'cause
No.
guys are like, oh, he's too manly.
But a cute little
I'm happy
jawline.
he's laughing at these jokes. I'm like, yes, all right, he fits right in.
Finally, he's a white boy. Of course, you'll get your jokes. Like half of him is white. Like
Half of him, yeah.
Yeah.
We just found out, like, we were just before we started rolling. Well, actually, we were already rolling, but I cut that part out. But we were talking about his family and everything. Like, but Sal, back to my jawline. I need to fix this shit. Not fix it, but like, I want to make it more defined. So I might buy the little.
What is more efficient though, with just doing the exercise or just getting the surgery?
Well, the thing is, it's not a very small surgery. To get your jawline done, you have to break your mandible and pull it forward or back, depends on how you want it. So it's a big surgery, and you have to wait till the bone adheres back.
Connects back.
Yeah, and that can take months.
So
And you couldn't, and you
The
won't be
machine,
able.
Amazon. Yeah.
Amazon.
Yeah, Amazon. Yeah, it's much better, and it's easier when you do it when you're younger because that's when you can still manipulate your mouth. That's why when you're young, they teach you how to do training so you can open your mouth cavity so you can sing better.
Oh.
So you can manipulate. That's how dentists and orthodontists they teach you how to move or they change your teeth or do mouth, exercises.
Yeah.
So you can fit your teeth back in its place or even remove.
So what you're
teeth.
saying is it's pretty much too late for me. Is what you're saying. I'm
Basically.
kinda
Yeah.
You're
Amazon.
He's like, yeah. Like, sorry, surgery it is for you, my guy. But it's like, hey, we cannot jump the gun here. Before we dive deeper into this conversation, let the people know a little bit about you. What do you do? What have you done? What have you studied? All that.
A little
good
bit of
stuff.
background.
Well, it's a long story to be honest. I
You
was
got
born
time.
and raised in Cerro Colorado in San Nicolas.
Her.
Yeah.
Yep, I went to
I'm not even
Filomena
close.
Colegio Arubano in San Nicolas, then finished in Colegio Arubano Playa. I got a scholarship to go study medicine, pre-med in FIT.
Oh, wow.
In Florida.
What the fuck?
But then I exchanged to Costa Rica where I finished med school. Then I applied for my specialty in general surgery. And I actually went everywhere. I wanted to go to Italy. I studied Italian. I wanted to
No
do
way.
Spain, so I practiced the MIR, which is a test to do your specialization in Spain. But before I went to Europe, I went to South America. So I went to Uruguay, Argentina, Chile, and Colombia just to practice doing exams over there. And I actually qualified and got the best test in Bogota, Colombia, which is a public hospital. And I'm till now the only foreigner to get accepted into that program.
In Colombia.
wow.
In Colombia, in Bogota.
Damn.
And this was in 2013. This is right during the civil war that they had in Bogota with the FARC
Okay, yeah.
and the Revolutionary Army there. So I was sent straight to the Hospital Militar in Kennedy and Soacha during all this trauma. And
I'm like, I'm here like here. I'm like, what? How many years are we talking about here? Like
I was almost 2 centuries, like 20 years.
2 centuries?
Yeah.
That's 200 years.
2 decades.
2 decades.
Yeah.
I was like 2 centuries. Like,
No, but it feels more like 2 centuries, to be honest.
I mean,
yeah.
after all of that?
yeah. And I understand.
The thing is, when I was there, we had to publish a lot of work because we were just sent out in the field and we would have to receive, like the Policía Militar, they have a wagon. They would just bring all these people. They would just pick up. We would, on the first year, you would just separate the dead people from the alive people and try not.
Jesus Christ. And
So
try-
that's how we started off. And afterwards, you go up, you move up the ranks, then you start doing surgeries. We would end up doing around 36 surgeries just during the night, which is from 7 o'clock at night till 7 o'clock in the morning because of all the trauma and
It's
accident
like,
that was
that's
going
crazy.
That's a legit graveyard shift.
on. Yep. And
It's called a graveyard
Like,
shift for a reason.
no, that's
and
what I'm saying,
F&B,
like-
but this is like a real graveyard. Like that. All right, to the next.
yeah, no, it was just like that. And if people would survive, fantastic. If they wouldn't survive, that's
Sorry.
normal.
Do you feel immune now? Like just like, oh, he died. All right, cool. Next. Like, and at some point, it could affect you.
In the beginning, no one can
Yeah.
take that simply because it would be on your head. But afterwards, after seeing so much, and you would see what works, what doesn't work, and you would figure everything out by trial and error, which a lot of people don't have right now. That's why a lot of people come to even in Holland, they have to come here to practice because they don't have a lot of things going on over there. Or even a lot of people try to go to Colombia and Brazil because you still have like accidents and shootings.
There's a
to
lot,
get
there's
some
some more
practice.
death or like near-death experiences happening to like, hey, here's
can
how we
practice.
can save. Yeah.
Yeah,
so when does it get normal? Sorry, just like
No, but that's general surgeries. General surgery is basically emergency surgery. Anything that happens at any time, like a car accident,
okay, yeah.
shooting,
Like, this just coming in.
stabbings, it's
Trauma
just
room.
coming.
Yeah.
Appendicitis, intestines, pancreatitis, cholecystectomy. It's all of that.
Something that happens like
it's just
happening
the ER.
right now. Like
it's the ER. Like,
ER.
let's go.
Yeah, emergency abdominal surgery or lung punctures or cardiac punctures. That's what we did. And because we had so many cases, we would publish a lot of cases, and that's where I got recognized in Brazil. And I got invited to go to Hospital das Clínicas. That's actually the largest hospital in all of South America and the sixth largest hospital in the world.
Damn.
And they have the biggest plastic surgery, reconstructive plastic surgery center in all of South America. And I was invited to be the foreigner in that group. There's only 6 that goes to that, and I was one of them.
Bro, I'm just like,
What?
Why hasn't anyone heard of you until... I've never heard of you until Shark brought it up the other day. I'm like...
That's crazy.
How does it feel to be like selected to be on, you know, one of 6?
Well, to me it was weird because first of all,
Like,
the
why
first
me?
question, even
Why?
when I went to Colombia, they were like, "What's Aruba?" They didn't even know.
Of course.
I'm like,
They asked me.
I'm right there.
They asked me if I spoke Spanish. I could speak a little Spanish, but I had to learn to speak perfect Spanish
Yeah.
by the time I was inside. Otherwise, people don't respect you. Don't
Correct.
get your space, your respect. So you have to learn the language. Just like when I went to Brazil. If you don't know Portuguese, you can't communicate with the patients. You can't communicate with the
You're
people.
kind of useless.
Yeah. So you had to. So actually, to get accepted, I had to do a test coefficient to recognize my ability to speak and understand Portuguese, which I aced. And I speak perfect Portuguese now. And
Give it a flag.
How many languages do you know right now?
I'm
assuming 5.
yeah.
I
this
think more
point-
than that.
No, it's 5.
Because like
Fluently.
Yeah.
If you count Jamaican or Caribbean or
Her.
Pata, I mean,
Talkative, what's up?
That's pretty much a whole language on itself.
It is. I keep saying it's a dialect. Bush English, everything is its own dialect.
Even this is a little off topic. When you're watching the show Supercell, like they were speaking some kind of English, I was like, I had to pay attention and read something like, wait, what the fuck are they saying?
No, for sure.
So as of right now, you're crazy period of your life. Now you're back in Aruba.
yeah. So I
go ahead.
finished about 2 years ago my residency in plastic surgery, reconstructive plastic surgery, and I
Okay.
spent a year there doing just general aesthetic and reconstructive in breast, post-bariatric, and purely aesthetic using new technologies, which are the technologies I brought to Aruba. So I'm the only person that has Renuvion, Morpheus, power-assisted liposuction. These are all
what are
new
these?
technologies that we
Okay.
use in plastic surgery or modern surgery to have minimally invasive procedures. So you don't have to have
The
long
scars
scars
and-
or big scars or big surgeries. So you can do everything with few scars or no scars.
So you mentioned lipo.
Yeah.
Okay,
So that's one of the main
into it.
surgeries I do in Aruba right now, which is liposculpture. It's
Yeah.
basically body contouring. So I can remove fat anywhere and everywhere except your face. Because you can't, you have to stay with the big.
God damn it. Look at him. What
It's
about him?
cute. I don't need shit. I'm perfect.
Be like this.
No.
Botox. You also do Botox?
I try not to do a lot of injectables. I
Okay.
like surgeries.
Okay.
But my sister helps me out with injectables and Botox and fillers and all of that.
Damn.
I don't like
family
touching
business. Little family
that. No,
business.
but she's also a doctor and she does cosmetic procedures. But she's in
Aruba.
Holland.
Oh, I was
Anytime
saying
she comes to Aruba, then she comes to my clinic and she does all the patients at
Oh,
once.
so maybe she'll come down for like a month and then like, hey, I'll help you out. Like,
Yes, she
so
does
everybody can
everything.
schedule. and
Exactly.
stuff.
How do I
So,
get it
so
in?
what made so you went for like 2 years. What made you want to get into plastic surgery?
To be honest, I
just saw-
knew I wanted to become a reconstructive plastic surgeon
So
since I
that's a
was
specific
smaller.
thing.
Yeah, because
Sorry, I just cut you
we
off.
were raised in Cerro Colorado.
Yeah.
We didn't have the same TV cable that everyone else had. We had Lago cable, and there was
Yeah,
a
it was
channel.
different. It was like
Oh.
separated. It used to be closed off.
Because we're pretty much close to the same age, and I'm like,
Yeah.
we pretty much watch the same shows. I'm like, what do you mean? Like,
No, because
different time zone?
because Colony was separated from the rest of the island, and it was its own residence, and no one
Yeah.
could go in. Only people that lived there could go in and come out. And it was usually the workers that used to work at Coastal.
At Coastal.
Lago.
no
and
shit.
they would live
Yeah.
Well, I
in
learned
Cerro
something
Colorado.
today. Holy fuck.
Yeah, and we would have satellite and cable from Lago and
Yeah.
not from the rest of the
Got
island.
it.
So we would have American channels. Like I would watch WGN, HNG, and there was a biological channel, and they kept showing trauma, accident, surgeries, and I used to watch that instead of cartoons.
Cartoons.
My mom thought I was crazy.
Yeah.
But
You're
I
like,
knew.
keep watching it. Go make that money, son.
So I went to study medicine first in the family because I knew I wanted to do surgery.
Yeah.
But then, because of all these things that happened during the time I was doing medicine, it all came into place. I didn't even ask for it. It just
It just
came.
happened.
It
Like,
just
yeah.
happened.
Life is like, oh, okay, go here and not go there. Now you're gonna start liking this. They're gonna move over here.
That's how it usually goes. Yeah.
That's crazy.
Okay. But that made you want to do plastic. But that's what got you into like going into the field of medicine, but specifically plastic surgery. What made you want to do that? Or reconstructive? Because you did mention like you kept saying reconstructive plastic surgeries. I'm assuming there's
The
a
thing
broad
is,
spectrum.
the concept of plastic surgery is.
I'm just thinking BBLs and boob jobs. Like that's what I'm thinking.
No, the thing is, plastic surgery in itself is a whole subject that was created after the First World War. And this is because we had to do reconstructions of anywhere you lost tissue.
Yeah.
So what we do is we take tissue from one part of the body and we place it to another part of the body. That's our specialty. But it kept growing. We work with skin, with fat, and with skin grafts, and anything that has to do with reconstruction. Like even fat grafting, liposuction, it actually started off because when people lost part of their body, and you can't just cover skin on fat,
Yeah.
on muscle or bone, it has to have subcutaneous tissue on there. It has to have fat on there. So we would have to learn how to grab fat from one part of the area and place it on the next.
Yeah.
When we would grab a big piece of fat and we would put it, it would just die off. The center part would all die off. Only the outer layers would survive because fat itself doesn't have any vascularization. So what we learned is if you grab fat through a cannula and you remove small little pieces, that integrates better. So that's how we learned how to do liposuction to fill in spaces and areas that people had defects.
Yeah.
Okay.
And now we don't use it for that as much. Now we do it more as in, let's just take the advantage of, removing fat somewhere because, hey, it looks better.
You don't need it, and then you
It's
sculpt
like,
the body.
I want
But that's how plastic surgery started off as. So plastic surgery actually, in its concept, is 85% reconstructive in the sense that if you have a big accident and you need a face reconstruction or you have breast cancer, you have to grab skin somewhere and you fill that. That's basically all of plastic surgery.
Yeah.
Only 15% is aesthetic, which is your BBLs and your breast.
My BBLs, shit.
Okay,
But
so
I know what you mean. But
I
go
have
ahead.
I have a girl that asked like if she can have a BBL, a boobl. So like she wants to
what?
take fat from somewhere and put it in her boob. Is that like something is that something like real or?
That's a new trend that I'm starting to hear a lot. Even a lot of patients that come to my clinic, they ask me if they can get fat put in their breast. And typical, because I try to be as honest and open with my patients as I can.
As you
I
should.
don't dismiss anyone. I just try to explain it to them so they can understand, like I explained to you guys.
I've heard that about you though. I've heard that about you.
So what I do is I ask her, do you have a friend that has big and heavy breasts? Yes. How do they look like? They drop. Exactly. Because fat doesn't give you any projection or lift. It just gives you weight.
Yeah.
And when you have weight, what happens? It sags.
Sags.
And that's exactly what you don't want. You don't want sagging breasts. So by putting fat, it worsens the situation.
Agreed.
The reason we use implants is because it has four main functions. First, it gives you volume. A lot of people want volume. Second reason is the shape, because breast by itself is just hanging weight. So when it's perky, when you're young, it looks nice. But when you start to develop, it starts to fall down.
Yeah.
And the other thing it gives is the round superior pole which is very important because when you put on clothes,
You need
that's
that
what you want
oomph.
to.
Yeah.
That's what you want to show. That's why girls wear bra because it lifts them up.
Well, cleavage action. Yeah.
Yeah.
And the implant, what it does is if it's well positioned, and that's the problem with most surgeries that's done nowadays. They just put any implants anywhere, and usually they put it behind the muscle. And when you put it behind the muscle, it doesn't hold the breast tissue up. So you see a lot of girls right now that come over and they have nice breast implants underneath the muscle right up here, but their breast glands are down here because it doesn't lift the breast
Yeah.
up. So the way we put it is a way that the implants stay in its place, but also hold the breast tissue. So it works as like a pillar. So it doesn't let your breast fall down. So even the breast implants that I use are permanent, so you don't have to change them anymore. So when you put it, it has to stay for a longer period of time. Otherwise,
What's the point?
What's
Like,
the point?
In 15 years, you're gonna come back like, hey, we have to do it again. I'm like, because I did hear, like, I know some girls that had to remove their breast implants like after 10 years because apparently back then it wasn't good, or like it had some sort of toxin in it, or something like that. So
yeah, there are many types of implants. The thing is, just like your cell phone, you have generations. You have the first generation, third generation.
correct.
So every time they try to have something changed or implemented or removed, depending on how it works in real life. And the first breast implants were smooth textured, which means your body doesn't react to it. That's good because you don't want your body to
attack
reject
it, yeah.
anything that you place inside of it. That's why the stents that you place inside your heart valves or your arteries, or even when you do, any bone surgeries that you put, any screws or anything, you don't want your body to reject it as a foreign body. Breast implants is the same, but the first iteration were just like stents. Your body won't recognize it as a foreign body, so it won't attack it. But this came with problems because the smooth textured implants would move around. So you would see the breast, the implants would fall over, and you would see the girls
Like,
would have to flip it and move it.
I'm not even gonna lie. I've been in a situation before when the boobs like on the side. I'm like,
Yeah, it moves.
I'm like,
I would
I'm like,
die.
I'm like, just help you squeeze that really quick. No.
Yeah, because it doesn't stay in its
No,
place.
I remember
So-
vividly, bro.
So
I'm like, I was like, first like, what the fuck? Are you okay? Like, it's fine.
So what they would do afterwards is they would place it behind the muscle, but it would still move. So they would have to wear this big thing to hold it down, and for it to scar in place before she could move her arms. Otherwise, your muscle could push it up or push it laterally or
shit.
down outside of its pocket. And then we started with textured surface implants, which created capsules. The capsules is because your body reacts to it but doesn't reject it. But it makes a small capsule that protects it and it makes it stay in its place. But the thing is, the capsules, we found out, gives inflammation.
Oh God.
And
This is
sometimes
so many
it
complications
does
when it
contractions. So it pulls it to the side and it could deform your breast and it hurts. And some people get breast implant associated illness, which is another illness.
That's where you
of
come in
general
and you start-
inflammation. And we would have to remove the entire capsule and everything because it gives inflammation. And in the worst case scenario, we'd even have some cancer, lymphoma, that happens because of the implants and the capsules.
shit.
So basically, what you're saying is, ladies, if you want to do boob jobs, hasibo research, pensé 2-3 viajes.
And that's the thing. Whenever I try to explain everything to patients, the problem is when you go to Dr. Google online, it just gives you a general explanation of implants, but it doesn't specify which one and why and which one did this person
You
use.
get the results that you search for.
And the thing is, the newer generation implants that I use has nano surface, doesn't have liquids anymore. It's progressive gel. So it maintains its shape and it holds the breast in place and it feels much more natural. You can lie to any boyfriend that it's real breast and they wouldn't even know.
Third comes like,
and
Something's different.
and they're permanent. They even have a microchip in there, so you can have your girl on GPS.
Perfect. Where's the right sign up?
No, no, no. No, it's not.
Kidding.
It's not GPS. It's
No,
not
it's
GPS.
more like if she goes to Colombia and gets kidnapped, I know how to find her. That's,
No,
that's what I'm saying, bro. It's called precautions, all right?
No.
No, because we would give girls the cards to have the exact type and volume and size.
in case
and
something
procedure.
happens abroad or anywhere, you
or they
can just
know
be like, "This is exactly what I have. Like, this is
But
my."
now we have the chip inside that you can just read like a credit card, and you can know who put it, what day, where
What
did
the
he put it,
fuck?
what size,
Bro,
what brand.
technology, bro.
Yeah.
So let's talk about, so you said, I had some more questions, but I want to go to talk about what you're doing right now in Aruba, and then we'll come back to like some of these crazy
Yeah, I
ass
fucks with
questions.
that. I fucks with that.
So I want to know, so you're starting a clinic, or is it already
No, I started
active?
operating in December,
So, okay, so last year.
end of last year, yeah.
And what exactly does your clinic do?
No, I have a clinic where I just see my patients.
Correct.
So it's just my consultation
Correct.
place where I
Yeah.
do.
Because it's a few clinics.
Well, that's my first project because I'm thinking of doing many projects. But the first project is just my work, which is plastic surgery. So that's where I do my consultation. I see my patients, but I can only do local anesthetic procedures there, which means I can remove lipomas, I can remove the upper eyelid if you need a blepharoplasty. Anything that I can do with local anesthesia, with sedation, I could do in my clinic. But anything that has to go to general anesthesia, which are usually larger surgeries,
Yeah.
that's what I operate in some. All my post-op patients I see at my clinic, which means I see all my wounds,
Okay.
I take care of all my... because to be honest, I try to tell my patients, look, I know it's your body, but it's my surgery. I make sure that my post-ops have to go through a nice post-operative timeline. I can't have someone walking around with a bad surgery. It falls on me.
Yeah.
So it's my obligation to make sure all my patients do well. So I made sure that my clinic can see all of my patients the day after surgery, a week after surgery, a month, 2 months, and 6 months, so we can do
the
the
proper
follow-up.
follow-up.
As long
Yeah.
as like, hey, for the next 6 months, we're gonna be doing these much checkups. Just make sure you show up.
So I have everything protocolized. So
Yeah.
everything is maintained. I love order. I love having everything protocolized.
Yeah.
And to this date, I have
You-
no
we should do a
infections.
workshop in here to give people, because I need that a little
I have
bit.
no infections, no wound opening, no complications, nothing that,
Can people come to you, like, let's say a girl who's watching that went to Colombia, got a botched up, messed up boob job?
So
Can they come to you
So
for,
that's
like-
how I started.
Okay.
So my first patients were actually post-operative patients that were operated somewhere else.
Yes.
And it was a horrible job, and no one wants to take the job. But that's my specialty. So that's how I started. So I started fixing all these botched procedures, and that's where I started gaining some fame in the beginning. And the problem is, in Aruba, we have so many patients that have done so many bad surgeries, and no one says a thing. Even some patients that were worked on so many times and can't do anything anymore by anyone else, these patients from AZV, even AZV are sending them to me, even though I don't work with AZV, because I'm the
whoa.
only person that can take care of these
On
patients.
Aruba right now, you're the only one who's like specialized in this.
I don't think I'm the only one. I think I'm the only one that could do some of these very intense procedures, or is willing to.
Yeah.
Like you're all right. Let me look at you, see if it's something we can.
You're the last hope for them, like for sure. Like it's like if nobody's gonna do it, like hopefully
Hopefully he says yes. 'Cause
Yo,
otherwise,
if he does not say yes, girl, you have to live with this for the rest of your life. Shit, this is on you.
Like even some post breast cancer operations, I've fixed some really bad botched boob jobs that have been done outside. I've fixed, and there are a lot more worse. Like even people that do injections of some fat burners, and they end up to be something else, and they have holes and
Oh my
things
God, I would
everywhere.
die.
I fixed that.
I almost,
and the
some
worst
shit
thing
like
we
that.
have in Aruba is biopolymers. People that inject biopolymers, which are like fillers, but they're not very good fillers, because you put them there, they stay there, and they can expand and migrate and cause a
somewhere
lot of
else.
inflammation. And people put them in their face, in their lips, and their in their butts, in their thighs, and it can disfigure your entire body,
Instead of
and it
helping
can
you
get
out, it's
worse.
working against you.
Okay, so wait, then like based off of what if you are going to get fillers or like Botox or whatever, like what are questions that you're supposed to ask?
First of all, the thing is, when we talk about injectables, people are very. The problem is the whole entire market is now being sold and branded like, it's all fashion and you have to look nice, you have to do this, you have to do Botox, you have to do injectables. There's so many brands and there's so many black markets selling these brands.
Yeah.
And the people that try to buy them for the cheap, which are usually people that are not registered doctors or cannot really do these procedures, but they do in their garages or at their houses
At
or
their
at their
trunk.
aesthetic clinic.
Yeah.
And, they end up not being the actual product. They end up being like these expandable petroleum products that just are horrible. And I've already removed a lot of these products from people from their backs because they put it on their glutes and then migrate up to their entire spinal line.
These are people that got it in Aruba.
A lot have done it in Aruba. A lot have done it outside.
The reason why I bring up Aruba is so it's for whoever's watching or listening, they're like, shit, I was going to do it in Aruba. Maybe I should think twice or at least do my proper research.
At least you have to know if the person who has done it is ethical, has the proper products, and if they know how to do it. Because, if you're going to do something with your body, you have to be sure that you really need it, first of all, and if it's worth it. Because if you change your face, you can't get it
That's
back.
it.
Look at your nose.
Guys, thanks for watching. We'll see you next week. Fuck this shit.
Oh my god.
No, but
I love your messiness. Like
This reminds me, again, it reminds me of the episodes like Justin and like
oh my god.
Kiana Kova, which is like sometimes we get guests that honestly we know nothing about, and we like having them on the show because we go into a conversation like, bro, I know nothing about you. So it's gonna be a very genuine conversation.
Yeah.
And the fact that you like hit me with these roasts or like I'm like, yes, let's
I
go.
love personality.
Yeah.
No, but that's how I talk to my patients too. I make
perfect.
sure I befriend my patients first
Yeah.
because that's the most important part. If you
Agreed.
want to have trust and you have to build some type of
That's
commitment,
facts.
I agree.
for them to listen to you, they have to trust you first. So you have to build some kind of, dialect.
And that's one of the things that I've heard about you, where I've heard like some people like they want to be like, okay, I'm going in and I actually want to get this size boobs, and you're like, no, I'm not doing that.
no.
Nope.
It's
I
not.
don't do
It
it.
doesn't fit for your body. I'm not doing it. So like,
Yeah, I really
this
think,
size will work.
Yeah.
And
I've always told people it's about the proportion of the body. Like you can't be like a skinny girl and a big ass titty. Like that's not gonna work. Or a big ass.
It's not only that. First of all, when you talk about silhouette and curves, there are distinctions because not every woman or person has the same waist or the same hips or the same
course.
size, because some people are tall and they have, very
Wide hip.
wide hips,
Yeah.
and other are tall and they're very skinny hips, but they have high profile hips right up here.
Yeah.
So anything you do has to work with the body structure.
Agreed,
Because your
yeah.
bone structure is specific to you, but maybe to the another girl it's a different bone structure. So you have to work with each one individually. And the problem with this is, like, if you go to a Spanish speaking, I've been to Spanish speaking countries. I know how they work over there. Instead of trying to fix it, they try to always put more. And then every time you
Yeah.
get a lot more than you should have, because now it looks disproportionate and it doesn't look natural. And the problem with this is you have to try to make it look natural for your body structure
Yeah.
and your composition. So let's say if the patient tells me, no, I just want a small, look,
Why?
if I put this size, it'll look nice today, but in 2 months, it's gonna look horrible, because you have to have a certain size for your body to maintain its work. It
Yeah.
has to work. It's like you're not going to put a table with 3 legs or with thinner legs. It's going to break. You can't. It's not going to work. So I'm not going to compromise my work because of someone being arrogant or being, I'm not a supermarket. You can't come to me and tell me what you want. No, I decide what I want to do.
Yeah.
And I always try to tell patients, you cannot come out worse than you went in. So you always try to do your best for patients to be happy. Like, even, I have my own group that does the massages, and my patients are always very happy. They're always, if you guys want to come over to the clinic and see some results,
Oh, just about to ask you, like, where is it and what's the name of it?
What is the name of the clinic?
it's Aruba Plastic Surgery and Aesthetics Clinic. That's in New Strat.
Where is Newstra? Because I don't know where that is.
Well, they just removed On the Rocks. You know where the...
Oh, okay, yeah.
It's right the small road right by On the Rocks. It's
so
right there. It's hidden because, people that do plastic surgery in
Of
Aruba,
course,
they
they don't
love
wanna-
discretion.
of course.
They love
Very smart.
privacy.
Yeah,
A
yeah,
lot of people don't want to be seen even going into the clinic. And, it's just come out, go
Got it. So
in.
it's
Which, let me just say something real quick. Guys, let's normalize minding your motherfucking business sometimes, okay? Not everything is everybody's business, okay?
Yeah.
If somebody wants to do something, like, mind your and stop caring so much what other people have to say, guys. Like, let that shit go. If you want to do it for you, because you want it, stop doing this extra shit. I'm sorry, you can continue, doctor.
No, that's fine. I agree with you, by the way.
It's like, is it like the street that goes like...
And yeah, exactly.
Okay.
So the thing is, that's the problem with the botched surgeries too. No one wants to talk about it. It never happens to anyone, but I see it happens to even high-profile patients, like high-profile. Like you can't imagine high-profile patients.
I can't imagine, trust and believe.
They have biopolymers, done this, fillers in lips and I fix them hiddenly because they don't want anyone to know. But the problem is because anytime you do something in Aruba, they want to publicize everything. So no one wants to talk about it. I understand that part.
You know what I should have done? I'm thinking about this now. I should have downloaded pictures of higher profile people in Aruba and go like, plastic surgery and then plastic surgery. What do you say? But when you don't show it, we're like, yes, no, yes.
So
Yes,
It's like
you.
also privacy, so you don't want to talk about it.
Of
So
course.
the first thing we learn, and we do our oath to, the Hippocratic oath, is we have to maintain discretion and privacy
100%.
with all our
I agree,
patients. And I find it funny that everyone asks me why I don't post anything online. I don't like posting before and after because it's our patients. And
Agreed.
that's the respect we give our patients. Unless the patient explicitly tells us, please post my result. I love this result. I'm not going to do it because...
Oh, you're not? Even if they tell you, hey, please
I
do
might
it.
do it. I might do it. I don't know. But
I guess it depends, like, how the surgery came out. Like, if you're happy with the results too, and like, hey.
But the thing is, Aruba is so small. Word of mouth is
It's
a
gonna
lot
travel,
stronger
so-
than...
Yeah.
Because a lot of people in South America, what they do is they post all these surgeries that are not even their own surgeries, but they pretend it's their own surgeries. And a lot of these patients here, they go over there, they operate, and they come here,
Shit,
and
botched.
everything's open, and this is done, and this is sideways, and it's horrible surgeries. And when I look at their profiles, they're not even registered plastic surgeons. They're just regular doctors that do plastic surgery, which is completely different. And people don't understand that concept. And people just see their Instagram and their TikTok and this and that. And then you get these compromised patients that I always try to help because regardless of what happens, that's my obligation.
Yeah.
So then this is why I feel like then the clinic is perfect for the concept that you're coming with because we understand. So you can like actually explain this from your clinic. So what people are actually getting is a safe person saying, hey, don't just go to any and anybody. Let me help you with that.
So my next project, that's not plastic surgery, which is it's called Aruba Medical Experts. What it does is it helps people that want to do surgery somewhere else, in Colombia specifically, come to us. We'll do your entire evaluation and we'll direct you to a correct specialist that will take care of your needs. And they'll start from beginning to the end, which means in Aruba, we do all the blood tests, all the radiology if needed, all the endoscopy if needed. And we prepare you for the surgery and make sure your specialists see you before and know what you want.
Yeah.
And if you and your specialist do get into a conclusion to do a surgery or do a certain treatment, you can specifically travel there to do the surgery over there, and they'll pick you up at the airport and take you to the hotel, the medical hotel, where they will operate on you, take care of you, and you'll spend a few weeks doing your recovery. And when you come back to Aruba, then we can take over and take care of you over here. which is what we don't have here. People, you would lose your patients that you don't know what they did, with whom they did it. At least these specialists are certified and they are known by me. Yeah. And they talk to me directly. This is what I did. This is what is to be done, and this is how it has to continue. Shit. So we can at least have a follow-up and continuation with the process. Because the problem with medicine is you can have an opinion or you can have an opinion, but if you don't align, then no one's going to look at the patient. And who's conflicted and compromised is the patient. And we can't have that. So if you want to operate in Colombia and you want a good surgery done, have to find a good specialist. And don't go to these shady places that they do things for cheap and 2 for 1. If you let me do your belly, I do. Come on, because none of them end up being a good surgery. It's impossible. I see them all the time. Yeah. And then they come over, they complain, no, but why did I do that? We'll try to fix it.
And this is why you're the perfect person for this. Because, I mean, not only did you network and already have that connection with the Colombian and the Brazilian, like the doctors, you already have that network. But then you are also the perfect person because you specialize in the niche of everybody doesn't want to touch this. I'll take these on. Now that I took these on, I know exactly what you need to prevent this.
Yep.
These other doctors on the island, unfortunately, sorry, you snooze, you lose, but they didn't tap into that. So now they are not, their knowledge or their whatever they're going to say is not as influenced as your, it doesn't have the same weight. Yeah.
Same weight.
As your word would have. So
the thing is, I had the privilege to actually seeing all these complications and all these botched surgeries. So I know exactly what not to do. Yeah. So that's how I learned what to do and how to do
Trial
it.
and error. Well, not your error. Somebody else's error.
Exactly.
Thanks to the trial, fix it up.
And sadly, when you see specialists that just operate on foreigners, like in Colombia, they operate on foreigners, and they build their entire network of Instagram and Facebook and TikTok on
popularity,
pulling more foreigners.
Of course.
And they know they're not going to see them anymore. So what they do is they just put you in a line. I'll operate on you from 7 to 12 and the other from 1 to 6. Doesn't matter if I finish the work or I have to finish. I have 30 minutes to finish. I can't do that. I operate 1 patient per day and surgery ends when surgery ends. It doesn't have a timeline because you never know what can happen and you have to finish your work correctly. And that's the thing. If you work on a timeline, then essentially you're not doing the things correctly. And that's when you get problems and all these botched things come out.
What's the craziest botched surgery you ever seen or could have you performed on?
Well,
if you can talk about it, maybe you don't want to talk about it. Maybe
aesthetic surgery or just reconstructive, because there.
I want to say reconstructive because it has to be that holy shit. Let me fix this for you.
Who the fuck did this to you?
Yeah. There you go.
Well, there are plenty because that's in all of Brazil. Brazil is very large, so we would have helicopter and planes sent all their most, the worst patient of all different states to our hospital, and usually we would have a lot. Like even if you would have the entire glutes and buttocks infected, and we would have to remove the entire buttocks skin and
cut out and
the thighs, and you would stay without any skin, and we'd have to just put skin grafting and skin
because they got cement and stuff like that injected into them, and then that starts eating the skin.
Or like the bodybuilder guys, they do these injections, massive fucking muscle, and they all end up dying. Yeah. Well, at least that's what I see online. I don't know.
Yeah, those are oleos that they inject, and it just. But that's basically what we do with fat. If we want to do fat grafting, we grab the fat, we put it inside the muscle, and it makes the muscle look bigger. But it's not really stronger. It just has more volume.
It's just the aesthetic of it.
It's just aesthetic. So that's basically what we do. Anything that works with contours, and like you saw the movie 300, all these fat guys with six packs. It's all about shadows.
How is this even
It's all shadows and contours and illusion. So that's what we do when we do abdominal etching, marcación, or when we do gynecomastia and we shape your pectoral muscles. It looks bigger than it really is. It's all working with angles and shadows. And that's how, if you can't do that properly, then you're a good plastic surgeon. But most specialists cannot do this.
Does your clinic do that? Does your clinic do that in Aruba?
I'm the only person that does it in the entire Caribbean.
So what
No
do
one
you
else has
consider
it.
yourself? A good,
I mean,
great?
no, I'm all right.
Not all right.
No,
Wait.
like look at it. All you gotta do is here's my patients.
Yeah, exactly.
You tell me. You know.
I like people to understand the work I do, and I want people to judge it by themselves.
Correct.
And that's it. I'm just a guy from St. Nicholas, you know. To me, it's just, I don't like attention. I don't like calling myself out. But I like talking about reality.
Yeah.
And that's the thing. I like my job, I like my work, and I like doing it well. And that's it. Like
That's what you should say. Like, you like doing it well. That's it. Like, you that dude. If you that dude, you that dude.
Yeah. So since I started here in Aruba, there's a lot of reconstructions I had to do, and that even caught the eye of Hauha, the hospital over there. Because when I came here, I actually wanted to work at the hospital. They said, "We're sorry, we don't have any money to pay for another plastic surgeon." All right, I understand. They asked me to wait until one of the plastic surgeons decides to retire or leave. And I said, "No, thank you. I'm going to start my own private clinic and see how that goes." It took a year because everything here goes slowly, and sadly, no one tries to help you. I've had some people at least try to help, and at least I got the opportunity to start working. But now they want to have talks again because they saw my work. They want my attention. But now my whole clinic is full. My consultation is full. I have a lot of patients. I can't dedicate more times on other patients unless we can work something out. If I have to work around their obligations, it's probably not going to work. I need things to run around my protocols.
Yeah.
So I have a question, just like to go back on for like the clinic. We were just talking about like people having to do like tests and all this good stuff, which they would end up doing here.
Yeah.
What time frame are we looking for, like turnaround time? Let's say, for instance, because we know here, if you do a blood test, it's like, okay, bring back aqui 2-3 semanas, botar por resultado. Is that going to be the case, or is like, are we getting like speed results? Like,
my mom is Irene van der Linde, the owner of Laboratorio Familiar. So
like he got the hookup, is what he's saying.
like-
so even my own patients that I have to operate in INSAM,
Yeah.
if I need any urgent or rapid test, it's done,
It's
and I
getting
have
done.
the results in an hour.
Yeah.
So just so you know, I have no problem with
Flex,
laboratory
flex,
results.
flex.
that was a flex. That was a
What
flex.
are these
And I'm
like-
not mad.
The most
I am
going
not
the
mad.
laboratorio familiar, me dijo, okay, then going. Like, I'm as like, hey, quita aquí, ¿entiendes? No puedo guardar
So
dos
wait,
días.
because I feel like we're kind of like making this about a lot about plastic surgery, like the clinic. But is it also for a knee operation, or maybe I want consultation for like my eyes, or I don't know. Is that stuff also included, or like?
So the new clinic, specifically if it's plastic surgery, I want it to be done with me. So we're not really doing plastic surgery
Okay.
there. So what we're doing there is gynecology, urology, orthopedics, bariatric.
This is all at the clinic.
Everything else you can do at the other clinic. If a patient wants to do something that I don't want to do, then they can definitely go there.
Like, great.
Like, come on.
Está llamando.
Over there.
Yeah, so I do send patients there that want something that I don't find appealing or I don't think is the best option for patients. But patients are koppig.
Yeah,
We can't do anything about it.
stubborn.
But at
And
least
is there like a switch around policy for, let's say, for instance, if somebody from Colombia wants to operate here with you?
Well, I do have a lot of patients that come from Brazil to operate with me in Colombia also because actually, where I did my specialty is actually the best known university for that specialty. So even like when I was in Brazil, you are treated as a god if you're a plastic surgeon from where I'm at.
I mean, Brazil, like that's
So the entire culture goes around plastic surgery. So even if you're a
100%.
girl, 17 years old, the first surgery you do, rhinoplasty.
your nose.
It's
Why is it good looking?
culture.
Listen, my last question, don't worry, I'm going to get there at some point. I'm like, it's about my nose, don't worry about it.
It's rhinoplasty.
Yeah.
All girls in Brazil, well, most girls in Brazil have their nose done at 17,
That's
which is the best
crazy.
age to do your nose. because your cartilage gets brittle with age, and at a certain point, you can't move your cartilage around. It'll break or it'll go back. So it's not worth doing a surgery right around after 35 years old, unless it's corrective.
Wait, say it again. 35? What did you say?
After 35,
Still got time. You still
your
got time.
cartilage gets a lot brittle, and it maintains its position. It's like your
So-
ears. It always wants to go back in its original position. Imagine me taking your cartilage and making it stay like this. It wants to go back.
Yeah.
Whether I put a
So
suture
after
there or not.
35, like, forget it.
Unless it's corrective. Like corrective, if you have a septal deviation or you have problem with your internal
Yeah, look at me.
valves.
Yeah, let me know. Because I'm 34.
See, if it doesn't have, if I don't have to move a lot of cartilage around or have to do any correction with cartilage, that's fine. But you can't come at 55 and asking for a new nose. It's not going to
Yeah,
work.
yeah.
Your cartilage won't adapt. Your skin has been like that for 55 years. It's not going to magically
Now you
go
want
down.
to change it?
No, it's
No.
not going to happen. And see, that's the culture in Brazil. 17, you do your rhinoplasty. 18, you do your breasts. And 24, you do your sculpture. After you get your kids, and everything redone. So it's culture. Over there, you have your clinic, and the people walk in with families. Is the dad, is the mom, is the kids. I can't wait till I turn 14 or 15 to do my ears.
getting
And then
this and
it's
that.
normal. Only here,
It's
well,
like-
not only here.
It's more places, yeah,
countries,
but- Aruba
it's
is one of
completely
them.
different.
Yeah.
It's we don't even want to hear about
Super
plastic
taboo.
surgery. Yeah, but as at least my degree in Brazil has a lot of validity and is internationally recognized. So I can go to Colombia, Europe, or America, and my title is very,
Yeah.
very important. And it's people that know about this that specifically come to me because they know I have that, and maybe they don't want to do it there.
So wait, like if we just talking like on a very big scale, this can actually lead to like ata and all this good stuff, because if you are bringing in tourists for, let's say for instance, they are coming in specifically to have surgery done by you, because a lot of the times you see like even on like Housewives, because you know I watch that type of stuff, okay? But they be talking, they're like always like, oh, you're gonna go like to the one of the Latin countries and yada yada yada. But most of the time they don't trust the system there, like the health system.
And they don't understand the language, which is another problem. The language
Which I'm
barrier.
saying, so if you are here, do you understand if you provide that same facility of having transportation from the airport, a place set in place where they're gonna have like, okay, after the surgery, this is where you're gonna be, like yada yada yada.
Yeah, no, I thought about that, but the problem is, first I have to fix locally.
Okay.
Then I'll think about internationally. If I didn't have as much patience locally or with,
Damn.
I would already thought about bringing patients from outside. But there's so much work right now to be done here.
do,
I
yeah.
would rather just finish my work here, and then I'll prop up myself for international recognition.
You did mention just now that, and I agree, I think in Aruba, I'm sure you agree too probably, that it's very taboo when it comes to plastic surgery. In what way can we change that? Because in Brazil, it's super common. So what can we implement from Brazil?
I don't think you can change cultures or mindsets. I think by being brutally honest on some cases, by me speaking to you guys and telling you what specifically is going on in Aruba, the things I'm seeing, maybe they'll talk more about it. But, the problem when you talk about yourself with surgery is that Aruba is very small. Everyone's going to talk about you. It's going to be the news of the day. And it's going to come out on 24 hours probably. So it's a problem. And no one wants to be recognized for that. In Aruba, it's so small. You want to be recognized for something positive, not something negative.
But I feel like that's where people have to like let that shit go, because most of the time, like people still notice. Like
Well,
we've
you're-
been know you before. You girl, you had them breasts. Like so we talking in the group chats. Of course, we be like, y'all see she got her breasts done and yada yada. So you think maybe nobody knows, but like
we know.
we know. We know this.
Some of the breast implants I put, you wouldn't even know.
Serio?
They are very natural.
Most girls
What-
talk also like these bitches can't wait to just be like, oh shit, look, I just got this
And,
done.
and,
Like,
and that's the thing. That's the thing. Yeah.
new bikinis, everything.
Straight to the beach.
You know,
You've been eating chicken.
girl, like the tops, everything be changing all of a sudden. Like
Like, why are you wearing less clothes now? What's going
Yeah.
on? Very small.
everything
bikini
needs
tops.
to show. Like
yeah.
no.
So, but with this new product that you have on the island, you feel or you believe that, like, not believe, you know that the scars are way less. Like, if somebody did a boob job with your stuff, it
Yeah.
would be a lot less visible and feel and look more real.
From the get go.
It's not just look, because you have to understand when we talk about boob jobs, there are many different types of boob jobs. You can do a lift, you can do a reduction,
Correct.
you can do an augmentation, you can have a short scar, you can have a long scar. Depends how big or how small they are. You have to work with what you have. So it's not like it's a one-size-fits-all solution for everyone. And that's the problem most people don't understand. They're like, but I don't want that scar. Well, you have to have the scar. Why? Because your breast is all the way down to your knees.
Shit.
There's no way I can lift that up without you getting a scar. You have to
Accept the reality
look.
of.
We used to do larger scars. Now we do shorter scars, and in some cases, no scars. But it has to be, it has to fit the results you want. Because if you're gonna do a short scar and it's not gonna stay nice, then you just better do the larger scar.
What is the difference between what scenario do you get a large scar, a small scar, and a
long-
no
Like-
scar?
Like the vertical scar, you have
I've seen those.
You have to have a vertical scar if you want to lift the areola on top.
Okay.
Because if your areola is down here and you want to lift it up, you have to lift it somewhere. So you have to make a way to lift it up. So that's the vertical scar. The horizontal
short-
scar,
That's a short scar. That's considered
no,
a short scar.
that's just a vertical scar.
Okay.
The horizontal scar, that's to remove weight that's dragging your breast down.
Okay.
So see, and you has to go from
The bottom.
one side of the breast to the other side of the breast. Problem is, most girls here have more than just breast. They have fat all underneath their arms.
yeah.
That's why what I do is I do always liposuction on the sides and right here. So I remove all this weight and I pull the breast in front. So you only have this breast to work with. So you get the
And
shoulder
you get
scar.
side boob.
Yeah, and you get side boob. Yeah.
There you go, shark.
Yes. I don't want it. I don't need it.
But you
My boobs
understand?
are good.
So you fix everything. You can't have nice breasts and have a lot of lump of fat on
Yeah,
the side.
yeah,
because
yeah.
that lump of fat on the side, that pulls the breast to sideways. That's why your nipples fight with each other and they separate.
Oh shit.
Yeah.
Okay. Oh, damn.
And then what's the short scar? Because is it vertical?
yeah.
I'm sorry, no scar. You said there's vertical.
So
long.
if you just want to do the lift
yeah.
and you don't have to remove a lot of weight, then you could just do a small short scar with the vertical scar.
Do people? Because from what I've heard, I don't know, like, do people still do like removing the staple and shit, like the nipple, and then put like breast implants and shit, or
That's
am I
not,
wrong?
that's not how surgery works. But I mean,
No, I mean, listen, I've seen fucking girls like they told me they remove their fucking nipple and do whatever, and they attach it back and they lose sensitivity.
you don't remove the
I've
nipple.
heard that too. Like
so-
weird.
No,
I've
again-
heard girls say that.
If I'm asking this question, I'm sure there's people
But
like,
if
oh, I thought that.
let's say I cut the body tissue from you and
Yeah.
and then place it back, it's not gonna attach. So
Yeah.
it always has to have vascularization. So you always have to leave branches of arteries
Some places connected. still.
intact. So what a lot of people do, they would hide the scar around the areola so they could place the breast implants. The problem is the visualization of where you're going to put the implants is very limited. So they would just go through the entire breast gland, through your areola, which if you're young, I wouldn't recommend doing this because first you would go through all your breast milk, glands, and then when you get to become a mother, you would have a lot more difficulty lactating.
Oh,
First of all.
shit.
Second of all, you can't really find the place or the pocket that you want to put the
implants. In
the implant correctly.
Yeah.
So I do none of that. I just do inframammary incisions, like small scar, and then the incision remains invisible, so you won't even see it.
So basically, guys, don't go to Colombia. Just go to him.
Per.
Done.
Like,
And fellas, you get a microchip. Track your girl.
yeah.
It's not a GPS.
Shit's okay. We'll keep it a secret.
Maybe in the future. Maybe in the
So
future.
do you have like things that like men come to you for?
Yeah.
What are the most common things that
Because
like,
we keep talking about boob jobs and
yeah,
BBLs.
what are the
What about
top
for
three
guys?
most common thing that guys come to you for?
Usually it's just
He says no, so I'm gonna be so bad.
it's the lipo-abdominoplasty, which is skin resection, big belly.
Yeah.
Liposculpture, which is the body contouring with abdominal etching, and gynecomasty, which is people that used steroids or were fat and lost weight, and you have a lot of flaccid skin and fat there.
Oh.
My technology, what it does, I remove all the fat. I shape the pectoral muscles, and I leave everything as if you were 2 years in the gym.
Okay, now I'm,
Okay, wait, hold up.
so I've been working
'cause
out for a long time.
It's not
but-
working. Like,
well, shut the fuck up.
No, I'm
Listen.
talking about for me too.
No,
That's
okay,
what I'm
okay,
saying.
okay.
I'm like, I'm invested now.
So I've been invested for a while, but now I'm like, I want to know, doing something like that, the ab shaping and the fucking chest shaping.
Yeah.
How long? First of all, how much would that cost? And number two, how long is this
Recovery
procedure?
time.
This procedure.
Okay, so most surgeries that are body contouring, I always try to leave everything around or under 6 hours because you don't want to compromise the patient's health under anesthesia. Narcosis is not something you want to be too long underneath unless it's an emergency, right? So I leave it around 6 hours, maybe 7, depends on the work. But also you can't do too much. Like if you're gonna do a breast lift and you're gonna do your abs, first of all, you're gonna have a pain in your belly, so you won't be able to sit down properly or get up from bed, which is a big problem because if you're gonna do your breast, you can't use your arms because you have limitation. Imagine if you combine your breast and your abs.
Everything, yeah.
First of all,
like-
you can't even sit on the toilet, and second of all, you can't use your lamps
Doesn't make
to lift up.
sense.
Step
So
by
what
step.
happens is most patients that do all these procedures simultaneously, they end up fucking
bag
up
of pain.
one of
Yeah.
the other surgeries. So that's why I usually don't combine. But with body contouring, you understand? And so no, I want to do everything. Oh, do my breast,
Yeah.
my belly, and my butt.
Because they want one recovery time, but
Yeah, that's it. But
makes
then
sense.
most of these patients that come back from República Dominicana, Venezuela, Colombia, they come to me. They're like, my butt is flat, my breast is on the side, and my abs is full of fibrosis. Yeah, logically, because you didn't take advantage of any which one. You wanted to do all
Everything at the same
simultaneously,
time.
and now you're sleeping on your butt that you just had.
That's
a
supposed to be
fill,
enhanced.
and now you have a flat butt with all the fat down beneath, and your breast is all contracted to the side. And that's the thing. People don't think about these things because, they get promised by other specialists, no, we can do everything
Everything.
simultaneously. Don't worry about it. Yeah, we
Specialists
can
made
do
the money.
I'll give you a
'Cause they're
special
never gonna
price.
see you again.
And post-op? Oh, I don't know about that. You want everything done.
post-op is an extra. Like,
No, post-op is the most important part of surgery. So I make sure that we have an entire team to make sure that you're well taken care of, that the massages are being done professionally. It even took some time because massages after surgery is very important because it lowers the inflammation and it lowers the recovery time. So all my surgeries are quick recovery, like even big abdominoplasties, post-bariatric, they're walking straight up after a week. Like even entire body lipocontouring, they operate, they go home the same day, and in 3 days, they're walking like normal. Because we prepare the patients before surgery, and we do procedures during surgery, and the post-op is well taken care of so they can recover quickly. And this is very important because as soon as you start moving after surgery, your blood vessels start working, and that's when you start scarring and healing quicker. So we know this, and that's what we promote. So most patients after a week, they're normal. But surgery itself is very long because I take my time.
So let's say if I did the fat removal over here, how long would the recovery be?
I would usually leave 2 small incision holes open. That's specifically for
The massage.
the massages. You
To
have
drain.
to do proper massages. And it took me such a long time to find a good massagist here because a lot of people do drenaje linfático and reductor. That's not the massage we're looking for. And people keep saying, no, I have a friend and I have a cousin and this, and they don't listen. They go to somewhere else and they ruin the surgery because that's not the massages. What you do is you have to lower the inflammation. That's not drainage. That's not reduction. That's not lymphatic. That's tissue liberation. It's a completely different topic. And the team I'm working with does it the best, and the results are fantastic. And you have to have this done in the first week of surgery. Mm-hmm. That's the best time to take care of it, because if you do it afterwards, it's not going to work as good because you wanted to prevent it from inflaming in the first place.
Yeah.
So you do it in the beginning. And by the 7th day, I close up those incisions and you're all good to go.
Happy life.
Yeah.
I'm killing myself.
Enjoy your new body. You still have to go to the gym, though.
I'm gonna look at calculation. 3 years in the gym to get to where he can get me in like 2 weeks. I want to see how much money I'm going to spend. No, I can spend it.
Is it worth it?
I'm like, nah, I can do one surgery.
Remember, surgery is not a solution.
No, it helps, though. It helps.
Collaboration to help you reach your goal. But you
I
can't.
agree.
The problem is, I did some guy here, and I mean, I spent 6 hours fixing his gynecomastia, using new technology to leave everything nice and abdominal etching. And this guy, fantastic result. Starts drinking, eating, going out, and it was
Bloats
going
up.
so well, and bloats up.
But like he did that like right after the surgery, or
He was going perfect the first 2 months.
Okay.
But then, you can't forget that you were operated on.
Yeah.
Your body is very sensible and it's still in a healing state. And your body always wants to go back to its original state where it wants you.
It remembers last.
Yeah. So if your surgery only heals 6 months to 1 year after, not 2 months after.
yeah.
So you have to be careful. Even the incisions, the small incisions, they turn red after a while. You can't go to the beach. I just did your breasts. If you see those pigmented incisions, those are because they get pigmented by the sun. That's because these girls, they get new breasts, they want to go straight to the sun. No, 6 months, no sun, no bathing suits. Take care. You'll get them out eventually.
Like basically, like suck it up for like 6 months, and after that, like you're good for the next couple of years.
Yep.
That's crazy work.
Sorry,
I would die.
no, but I mean, you don't have to tell me the price right now. But like once the camera stops rolling,
it's not about pricing.
No,
It's about work. It's how many hours you have to put in, because it might be the same surgery on paper, but the work I have to do on him is completely different than the work I have to do
So
to
basically,
you.
you say it's a surgery and like 10 massage sessions for him, and maybe 15 massage sessions for me.
No, it's the hours I have to work on a patient at the hospital, because sadly, that's how INSAM charges me. They
Yeah.
charge me by the hour, how
Yeah.
long I have to do work. So if I can do it
5
under 2
hours.
hours, it's cheaper than if I have to
Got
work
it.
4 hours.
So
or
everybody's different based on the mass and exactly what.
work.
How long the work might
Yeah,
take.
yeah. Oh, trust me, I'm gonna hit you up.
And this is the first year. So
sculpt
my
this
first
body.
year operating, I'm doing prices, or I'm charging prices comparable to Colombia. Sadly, next year I have to increase the prices because I'm barely maintaining myself as a clinic open. But I want people to know my work, understand what I can do, and all the technologies I use are very expensive. So eventually I have to start.
But that's what happens when you invest in yourself. Your
Yeah.
price just goes up. There's nothing wrong with that. It's like you're paying for value. And you clearly just sat here and explained to us why your price is what it is and why it has to go up to what it's going to be, because you're not getting a bullshitter. You're getting a professional that's worth so much that people will legit travel for.
Yep.
And you have it right here on the island, like locally, right here, like.
in St. Nicholas.
Come on.
Listen,
No.
as long as I can still sign up for this year's price.
He's like,
'Cause I'm like,
I want
great.
today's price,
When
not
is that
tomorrow's
next
price.
year, I'm like, well, that's why I'm signing up. My birthday's coming up,
Hey, I have a few patients ready for carnival. They're like, just set
Oh,
me up.
shit.
And they're bathing suit ready for
Bro,
carnival.
I just want to look good. Like,
I'll go to the gym.
Fucking-
Like I like having a
I'll
nice
still go to
fat
the gym
ass,
after surgery. I don't care. But it's more like,
I don't
it's
care.
like if I have to work 3 years to get to the level he can get me in 6 months, I can
I'm
get.
not mad about it.
I get
I'm
there
not
in
mad
6
about
months,
it.
and then I just have to maintain the fucking body.
And that's the most important part. Maintaining and organizing your life to not go back to where you were before surgery. And that's the hardest part because
Yeah.
we're going through some years that we lose metabolism. Like we're around 30 something years old. So what happens is when you're young, you burn a lot
Easy,
of calories.
yeah.
And we usually don't change our habit of eating.
Agreed.
But with age, we lose metabolism, and so you don't use as much calories. So that's why we start getting fatter with age, is because we don't change our eating habits. First of all, in Aruba, we drink all the time. And
Y'all,
we always eat out.
y'all drink all the time.
And if you don't change your habits and you don't increase your metabolism, I'm sorry. That's why most of us over here, we're all overweight.
What are you talking about? Why are you saying us?
He's
Because
talking about general in Aruba.
okay.
not
Us
the three of
Arubas.
us.
I know you called me Latino, but no, I'm Aruban.
I'm sorry. It was giving Latino
earlier.
vibes.
We're like, hey, like, are you Latino? Like,
No,
'cause
everyone asked me that. To
you
be
do have
fair,
a-
to be fair.
I said it earlier. You had a little bit of an accent. I'm like, I wasn't sure. Like, it's a Linde, but I don't know if there's Latino somewhere in there. People think I'm Latino. Like, are you 100%? Like, are you Brazilian? Are you Venezuelan?
I
Are you-
can't see that.
Yeah, well, it is what it is. No, but I found this again. This is the kind of episode I like because we go in not knowing what we're gonna get ourselves into, and then we get to genuinely learn about what you do and things that you've done, and then we can ask questions and know more shit because it comes from a genuine place. There's no fucking script
Yeah.
nowhere. Like you saw, I literally met you in person like an hour and a half ago, and then we just started having a conversation.
Yeah, but those are the best conversations.
I agree.
100%.
I agree. And this is why people love this show because and people know this. Like him and I'll have like 5 questions and I wrote like 15 and I didn't even ask like 5 of them. Because you kind of answered most of them without me even asking.
Yeah.
And some of them are just like, I don't want to ask this because like what you're saying right now, I find more interesting and more serious than whatever bullshit question I had lined up over here.
Yeah, so that's why I try to do with all my patients all the time. I try to set up circumstances and situations so they understand what I'm trying to say. So I always try to use analogies.
Yeah.
Because people understand analogies.
100%.
And if you don't convey the information for your patient to understand why you're doing something or why you shouldn't do something else, then why bother?
Agreed. Agreed. Now, my final question is, what would you do with my nose? Like, if you see, like, you're fucking laughing, but this is dead serious. I've talked about this. Like, I've talked about a friend that
No,
did
you've
a
been on
surgery.
this nose forever, and I remember I used to laugh at your nose.
Fuck
So
you.
take
Like,
your time.
if you would say, like, all right, not you, but like, what should be done? Or just leave it as it is.
Like most guys that come to my clinic to do any nose surgeries, I always try to remove that idea because has anyone else, other than yourself?
It's breathing problems. That's the reason. It's
Okay.
because
See, that's different. That's functional.
it's not for aesthetic or whatever. For me, it's like I'm not even joking. Like y'all can fucking know right now. But when I go to sleep, I use like these nose strips that like
I was about to ask you if you open up your nostrils like this, do you
Yeah.
breathe better?
a lot better. Like I start using these. I think it's breath, whatever. It's like a thing. It opens up.
So
your-
what
your-
happens is your nose has 2 valves, an outer valve and an inner valve.
Yeah.
You probably broke it inside, which is why the right side is more collapsed than the left side,
Yeah.
which is the outer valve. But it's not collapsing outside, but it's collapsing
The
inside. So what you can do is you have to remove a piece of cartilage graft from your septum, and you have to use a spreader graft to open it up so it holds it open.
Until
So
it
that's
heals.
easier because that's
Yeah.
functional. Functional is a lot easier than
That's what I care
aesthetic.
about because I would
But
try
we
it
could
for a
fix
week.
the outer part here too because that's also broken.
God damn it! Oh, right here. Yeah.
Yeah,
I
it's
feel
broken.
it. Shit.
No,
I didn't
I
even,
can
How
see
did you
it.
break it?
I just found out I broke it. I didn't even know. I didn't know I broke it. But because I never. Maybe I was born this way. I don't know.
You can clearly see this one is smooth.
Yeah.
This one is indented. This is a fractured cartilage.
I
I
shit.
just found out. Like maybe I was born. Can I be born this way?
No, it's broken.
Somebody punch you.
Oh, somebody punched me. The
You got your
fucking
ass
face. Maybe I got
beat.
and like blacked out. But again, I tried it for like 1 week, like no strip, and then 1 week no strip for sleeping.
No, it changes everything.
I feel like a whole different person. I go to the gym.
Damn.
I usually go in the treadmill in the corner because I find it a little embarrassing to wear it sometimes. Like I have the clear one, so you don't really see it from far. So you'll find me in the fucking corner of the gym on a treadmill, like
Breathing, like
and I'm
finally
fucking running. But when I don't have it, I struggle to run.
a long distance.
Correct. Yeah. So that's why it's more for me. It's functional, not aesthetic.
Okay, no,
'Cause
that's fine.
So I'm gonna give you a call for multiple fucking things. Well, real quick, like I think we're gonna end this right here.
Yeah.
You have a
You're gonna have
question?
to come back for sure.
Yeah.
You guys just call me up anytime.
100%. So real quick, where can people find you?
Plug yourself.
The top camera is your camera. So where can people find you and all that good stuff?
It turned off.
No, it's on. It's on.
on,
The
yeah,
screen
yours is
died.
Well, I am Dr. Patrick Vanderlyn at Aruba Plastic Surgery and Aesthetics Clinic in Nieuwstraat 47. We usually receive all information via WhatsApp. My receptionist gets all information and asks for everything we need to put you inside the system and to book. We're usually very full of consultations, so sadly have to wait at least a month for most consultations. Surgeries, it's all full for the entire rest of the year. But if you want any information or you just want to talk to me, you can WhatsApp 699-0499.
Once I watch that, I'm gonna because all information I always put in the description. So like any websites or whatever.
Well, we have our website, www.arubaplasticsurgery.com.
That's
We
a nice
have our
one.
Instagram, Aruba Plastic Surgery. We have our email, info@arubaplasticsurgery.com. And WhatsApp, I check the WhatsApp sometimes.
Perfect. Well, Dr. Van der Linde, thank you for coming on the show.
Thank you for having me.
And we're probably gonna bring you back in a few months. Maybe after my surgery. And
We'll
then,
talk about the tales of the surgeries in Aruba because
please.
I see everything.
100%, because that's I think, and we turn.
I think next time we can specifically talk about like certain things. Now it was like just generally getting to know a little bit of everything. But next time we have like a topic of like, okay, let's talk about these, this, and this.
Depending on what the people want to know.
Yeah,
about,
of course.
And we can make it. We want to make it more normalized. Like we want to normalize this conversation because like this is also the reason why we started this show because we started talking about a lot of taboo things in the past, and some people didn't like it. But now they love it.
You guys can even do a Q&A with your own followers and ask them what they want to ask me, and you guys can ask me.
100%.
Let's do it.
We got a few. So for next time, for sure, we're going to have
100%.
way more.
All right, guys. Hope you all enjoyed this episode, and we'll see you all next week. Peace.
Thank you. For having me.
Bye. See ya.